EBMT is the European Society for Blood and Marrow Transplantation and is the largest society for stem cell transplantation and cellular therapy worldwide.
We have over 4,000 members from nearly 600 transplant centers worldwide in more than 60 countries.
EBMT is a passion for saving patients' lives. It's about data collection, education, scientific research.
EBMT is, for me, a great big family. We come together to exchange ideas and share practices.
At our annual meeting, all the healthcare providers who are involved in stem cell transplantation and cellular therapy come to the meeting to exchange their experience and provide cutting-edge technology in our field.
What makes EBMT special is that we are special. We're innovators and we're leaders, and we challenge ourselves on a day-to-day basis.
What's very exciting about the annual meeting this year is that it is virtual, which gives everybody the opportunity to really get connected with EBMT without having to travel.
EBMT 2020 is perhaps our meeting so far with the highest scientific quality. We have a number of randomized controlled trials that we had never met in conferences before.
What is exciting about the EBMT annual meeting is that ability to learn and share experiences, to be able to quiz somebody afterwards and really get under the skin of the EBMT practice.
So EBMT is providing all doctors and scientists the most cutting-edge development, the best education you can get in stem cell transplantation and cellular therapy. We have a registry with more than 700,000 transplants reported.
In addition, EBMT offers scientific educational opportunities to data managers, to quality managers, to pharmacists, to psychologists, to transplant coordinators, to all the scope of professionals that bring together hematopoietic transplantation and cellular therapy.
What the EBMT does for patient, family and donors is to make sure that the bone marrow transplantation has the best outcomes in quality-controlled centers.
EBMT as a society has allowed nurses to flourish. It requires a highly motivated, educated and experienced nurse to work in the field of transplantation. There are many experts across Europe, but they all come together to our annual meeting for the good of our patients' care.
Dear EBMT member, colleagues and friends, so this is a very warm welcome to the 46th edition of the annual meeting of the European Society for Blood and Marrow Transplantation, which also is the first completely virtual meeting in the history of our society. And this is because of the worldwide, still ongoing COVID-19 pandemic, which for sake of health for our members, the speakers, attendings, and also staff does not allow to perform this year's meeting as an on-site meeting like we did in the previous years. So to move from a planned and already organized on-site meeting within 5 months to now a completely virtual meeting was really a major challenge for the entire EBMT society. And I'd like to thank especially the local organizing committee, but also the entire EBMT staff, especially the Congress management team, and all who worked hard to help to make this first virtual Congress in 2020 to become reality and a success. I'd like also to thank all of our sponsors who maintained their commitment of support after the decision to go completely virtual, namely the top-tier company supporters, Jazz, Bristol Myers Squibb, Gilead Kite, Novartis, Pfizer and Sanofi. I also would like to thank DKMS for supporting the implementation of our e-learning platform, which has become, in this pandemic times, the most useful tool for our educational activities for physicians, scientists, nurses and other healthcare providers, with regular webinars and online courses, such as the recently successful launched CAR T-cell course. As registered attendee of this virtual meeting, you will have the possibility to listen on demand to several interactive virtual sessions with contributions from invited speakers from the meeting until November 1st, and thereafter, as EBMT members, also on our e-learning platform. So this new format of Congress allows you to visit an e-poster gallery highlighting all the accepted abstracts of EBMT 2020, a virtual exhibition for delegates to visit, and also in addition will provide you networking opportunities, either one-to-one or group chats, video calls, an ability to schedule meetings with other Congress delegates. So despite the difficulties caused by the ongoing COVID-19 pandemic, we will present you in educational sessions, workshops, How Do I sessions, and others, the most recent and cutting-edge development in stem cell transplantation and cellular therapy in order to improve your knowledge and skills in our field. In addition, as an open-mind society intending to foster collaboration across continents, you can also attend the joint sessions with our sister societies such as CIBMTR, ASTCT, KSBMT and Latin America Group, as well as EHA. Thus, I also would like to thank the speakers and chairs of the sessions who attend the time-consuming training sessions and recording of their presentations to this first virtual meeting. So since this is the first time EBMT is performing a completely virtual meeting, please apologize if some technical or unforeseen problems occur during the meetings. So now I wish you a very exciting and successful virtual EBMT meeting. And thank you for your attendance.
Welcome to the 46th edition of the EBMT annual meeting. Welcome, in fact, to our first virtual edition in 2020. As you know, in light of the global COVID pandemic and the big impact that it's having worldwide, EBMT decided a few months ago to hold this year's annual meeting in a fully virtual model. I'd like my first words, my first thoughts in this opening ceremony to be dedicated to remember, to honor the memory of all those patients who suffered COVID and who we've lost. In particular, family, friends, or loved ones, because this has affected every one of us, and also, especially, healthcare professionals, healthcare workers who've been at the forefront of the fight against coronavirus and who we lost in this pandemic. I want these words and I want the work that we've done to put together this meeting to be dedicated to them all and to honor them all. My words, I want to be also of gratitude. Beyond the pandemic and beyond the difficulties that we are still facing, we've managed to put together what our main commitment is as a society, putting together cutting-edge science, a program that provides us well high-level education in hematopoietic stem cell transplantation and in cellular therapy, and also provide you all with a platform that will allow you to interact with each other in different new formats. All this would have been impossible without the help from many different partners. I'd like to first thank our sponsors. Without their commitment to EBMT, without their support, without their help in the transition to this new virtual model, it would have been impossible to be talking to you today, to be holding this virtual meeting. Also, I'd like to thank the EBMT team. The EBMT team has done a huge amount of work to transform what was already all set up in March as a meeting in Madrid and transform that into a virtual meeting with a novel platform that we all hope is going to be very useful and for all of you. Also, I want to thank the speakers, the faculty. They've been incredibly responsive to the needs, and they've adapted to, through the past few months, through the summer, recording and preparing their presentations and posters in a way that you will be able to enjoy the most. And then finally, I'm gonna finish this introduction thanking to all of you. We had high expectations for the meeting, as it was already. for Madrid 2020, and the reality is that despite these difficulties, at closure of registration a few days ago, we have nearly 1,000 more registrants than last year in 2019 in Frankfurt, over 6,500 participants in the meeting. And that is only thanks to your commitment, your interest in the society, and how you see yourself as part of the messages that we try to convey from the European Society of Blood and Marrow Transplantation. We have for you ready a Congress, an annual meeting in a new virtual platform that is going to provide you with virtual interactive sessions. It's going to provide you with electronic posters that you will be able to review at your convenience. We'll also provide you with a fully virtual exhibition area where you'll be able to interact and to learn about new products, about new drugs, and also with various tools from chats to video messaging to different formats in which you're going to be able to interact with your colleagues. I hope that you'll enjoy the meeting, and I just have to say thank you for your interest and enjoy EBMT Virtual 2020. Thank you.
Hello, my name is John Murray and I'm the Nurses Group President, and I'm pleased to be able to welcome my nursing colleagues to our 36th annual meeting. Many thanks to the local organising team and the Nurses Group Scientific Committee for pulling this around and making sure that we continue to be well educated in 2020. This year has been challenging for the whole EBMT community, and in many places, nurses have been very much front and centre dealing with the extraordinary circumstances that COVID-19 has so far presented to us. The situation in many countries is becoming more settled, but we're all aware of the precarious state that we exist within. We may never be quite the same again. Meetings have been deferred and some cancelled, which is of course correct. It is now possible, however, to adjust to this crisis by coming up with new ways of working. In this respect, EBMT, as well as many other societies, has transformed into the digital environment, and I'm pleased to still be able to offer education to our haematology and transplant nurses across Europe and the rest of the world. It's difficult to speak to anyone without having to discuss COVID-19 at some point in the conversation, but I do not want to dwell too long on this topic, as many others will be sharing their thoughts, and within the programme we have dedicated COVID-19 discussions, but I do feel that it must be acknowledged at this extraordinary time. I'd like to thank all of the key workers in all walks of life, not only healthcare providers who have helped to maintain our communities and kept society functioning. Nurses have very much been at the forefront in this epidemic, and the EBMT Nurses Group has produced 3 webinars. The webinars have covered the psychological impact of COVID-19 pandemic on nurses, their experiences and tips, and building strategies to cope with going back to normal, and the final webinar was on recovery post-COVID-19. Many nurses shared their own experiences, and I would like to thank Isabel Salcedo, Julia Ruiz and Troy Chase for this series of webinars, which have been very well received. Although we're not together in person, I hope that this new digital format allows more nurses to attend virtually. The content is available in real time and on the website after the conference to enable those with busy work and home schedules to have the opportunity to learn at their own pace and at a time of their choosing. This may well influence how education is delivered in the future. From a nurse's perspective, 2020 was nominated to be the World Health Assembly's celebration to honour the 200th anniversary of Florence Nightingale's birth, and to advance nurses' vital role in transforming healthcare around the world. This was to be titled the International Year of the Nurse and the Midwife. Circumstances may have somewhat gotten in the way, with celebrations in short supply, but the vital role of nurses has never been more brought into focus than by those who are on a daily basis face to face with this pandemic. The WHO stated that nurses and midwives provide a broad range of essential health services close to the community and in all levels of the health facility. The transplant community is a small part of this wider group. The nurses programme may be abridged, but I guarantee that it will punch above its weight and deliver on all fronts. We begin our programme this afternoon with 2 sessions, the first on steroids, the haematology bad boys. This is followed by a second session on graft versus host disease, giving practical hints and tips. Monday sees us at full speed with the 12th Distinguished Merit Award. Please tune in to find out who this exceptional individual is. The sessions then range from back to basics, to how do I improve my skills, to how do I become an expert, a whirlwind journey of learning in 3 days. It will, as usual, lead to some discussions and debate among the attendees. The EBMT Nurses Group continues to grow and we're developing our nurses along the way. I'm sure that you will all agree. I wish you all a successful meeting experience for 2020 and I hope to see you and meet you in person in Madrid in 2021. Thank you very much.
Welcome everybody to the virtual EBMT Annual Meeting 2020, and especially those who now are able to join for the first time. So grab a coffee, make yourself comfortable in your garden, your office or your home. And imagine somewhere out there in the world, somebody else is watching the same presentation like you do, and maybe even at the same time. So I think this year, more than ever, it's all about being connected. Because social distancing has become the norm for many, and Corona threatens cancer patients on several levels. For example, insecurity. Will my therapy be postponed? Is it safe to go to hospital? Communication, masked, that inhibit to really see each other's face, or there's a lack of electronic devices. Also loneliness is really facing many patients. Visitors banned from hospitals. Patients really miss their emotional support from friends, from relatives, and also the practical support system. But I think, having said that, hospitals have been doing and do still everything to protect patients. So I would like to take this opportunity to give a huge thanks to nurses and doctors who really take excellent care of patients during the pandemic. The speakers of the Patient Family Donor Day will also address the impact of COVID-19. Traditionally, this day is about connecting with fellow patients, carers and donors. It's about the latest scientific trends and the special relationship that often exists between a treating physician, a clinician and a patient. This year will be quite different, but we want to maintain a personal touch. So it will be live for 2 hours, moderated throughout, and we encourage everyone to ask questions. We aim to improve the communication between patients and EBMT professionals. In the 2 years the Patient Advocacy Committee exists, we are increasingly involved in and part of EBMT activities like publication and educational events. And with passion and many ideas for the future, we focus on the themes education, advocacy and science. EBMT working parties develop and manage scientific proposals and contribute to the definition of guidelines and policies. And with the role of EBMT registry in cell therapy, EBMT has a lot to offer to patients and European patient organizations. On the other hand, they have a lot to offer too. Clinical research is no longer a field reserved just for clinicians and pharmacists. It is important that patients whose life depend on it are better represented. And we ask you to consider to open up to the possibility of new partnerships. This year, the EBMT is running a survey on patient involvement in clinical research, and we really would like to hear what your experience is and what you think. It's open till the first week of September. Feeling connected comes in all shapes or forms, like the virtual meeting, clinical visits, and network opportunities. EBMT has a lot to offer all year round, but especially this year is excellent for feeling connected, getting educated and live your passion. So enjoy it.